We've all seen countless TV shows and movies where a patient falls into a coma. The emotional scenes often depict family members gathered around the hospital bed, hoping for any sign of life, any movement or response that could signal that their loved one might wake up. These shows often portray various attempts to wake the person from their coma, reading them stories, playing their favorite music, or even talking to them nonstop, hoping to trigger something inside their minds that will bring them back to consciousness. These scenes can tug at our heartstrings and make us think that comas are simply a prolonged sleep, something people can easily recover from with time and care. However, real-life comas are far more complex and less predictable than what is shown on screen. Before we begin, don't forget to like and subscribe so you won't miss out on future videos. In reality, comas are medically complicated states of unconsciousness with numerous causes, effects, and outcomes. Modern medicine, despite its numerous advancements, remains limited in its understanding of how to successfully treat comas. So what exactly happens to your body when you're in a coma? Before diving into that, it's crucial to differentiate comas from sleep. Although the word coma originates from the Greek word for deep sleep, the two states are completely different. A person in a coma isn't sleeping, they are in a state of profound unconsciousness. Unlike sleep, where a person goes through cycles of light and deep rest and can be woken by external stimuli, a comatose person is unresponsive to everything around them. No matter how loud the noise or how intense the environment, they do not react. This makes it clear that while sleep is restorative and essential for daily functioning, a coma is the brain's way of shutting down to focus on survival, often due to severe trauma or injury. When someone is in a coma, they are incapable of responding to external stimuli. For instance, you could blast the loudest, most deafening music near a comatose person, but they wouldn't flinch. Even pain stimuli such as pinching or poking wouldn't elicit a response. This is because the brain's normal sensory processing and awareness are disrupted. Historically, doctors employed extreme methods to shock comatose patients back to consciousness. These methods were not only misguided but also dangerously ineffective. Some of these practices included exposing patients to open flames or plunging their bodies into icy water, all in the hope that these extreme changes in temperature or environment would trigger a response. In the most bizarre cases, doctors would even resort to bloodletting, removing blood from the body, or as mentioned earlier, completely emptying the stomach, possibly believing that hunger would awaken the patient. Unsurprisingly, these methods were unsuccessful. Comas can occur for a variety of reasons. One of the most common causes is traumatic brain injury. When the brain experiences a severe impact, such as during a car accident or a fall, it may shut down as a protective measure, allowing the body to focus on healing and minimizing further damage. However, trauma isn't the only cause. Strokes, brain tumors, drug and alcohol abuse, severe infections, and even underlying medical conditions like diabetes can all lead to comas. In some cases, a coma is deliberately induced by medical professionals. This is known as a medically induced coma and is often used to protect the brain from swelling or further damage after an injury. During times of severe head trauma or disease, the brain can swell, pushing against the skull and cutting off oxygen to vital areas. By inducing a coma, doctors aim to slow down the brain's activity, reduce swelling, and give the body time to heal. While many people believe that comas last for years, most comas actually last only a few weeks. Beyond this point, if the patient does not regain consciousness, they may enter what is known as a persistent vegetative state. In this state, the body continues to function, but higher brain functions remain inactive. Unfortunately, the longer a person remains in this state, the lower the chances of recovery. Even if a patient does wake up after an extended period of unconsciousness, they may experience permanent disabilities. These can range from mild to severe, including speech impediments, cognitive impairments, or difficulty with coordination and movement. For some, the journey to recovery can take months or even years, and in some cases, full recovery may never be achieved. Medically induced comas, on the other hand, are different from those caused by injury or illness. When doctors induce a coma, they do so to protect the brain from further damage. Conditions like traumatic brain injuries, drug overdoses, or certain diseases can cause the brain to swell dangerously. This swelling can create pressure inside the skull, potentially leading to brain damage if not controlled. By slowing down the brain's metabolism and electrical activity, a medically induced coma helps reduce swelling and inflammation, giving the patient a better chance at recovery. This controlled shutdown allows the medical team to manage the brain's pressure dynamics and oxygen flow, preventing further complications. There are several different types of comas, each varying in severity and outcome. One of the less severe forms is the vegetative state, where the patient's body can make physical movements like yawning, grunting, or even grimacing. However, these movements are not responses to any external stimuli. Rather, they are involuntary actions of the body. For family members, seeing these movements can sometimes spark false hope, making it seem as if their loved one is beginning to regain consciousness. Sadly, in most cases, these movements do not indicate any real progress. The brain remains in a low-functioning state, operating only at its most basic levels. Another type of coma is catatonia, which involves a complete lack of movement or response of any kind. Patients in this state require extensive medical assistance, including machines to help them breathe and in some cases to even maintain their heartbeat. The most severe form of coma is brain death, in which higher brain functions have been completely destroyed. A person who is brain dead has no chance of recovery, as their brain can no longer perform essential cognitive functions. The body may continue to breathe and swallow autonomously due to the primitive brainstem functions, but the person is no longer alive in any meaningful sense. While not technically a form of coma, stupor is a state of extreme unconsciousness that is often grouped in with comatose states. In a stupor, a person can be awakened with considerable effort, but they typically fall back into unconsciousness quickly. People in stupors often recover on their own, but there is always a risk that they could slip into a deeper coma, where essential functions like breathing might be compromised. When someone is in a coma, their brain shows no signs of cognitive processing or awareness. It is as if the brain has been switched off, unable to perceive or respond to the outside world. In less severe cases, the body continues to breathe and the heart continues to pump blood. If the airway becomes blocked, a comatose patient may even cough reflexively. However, beyond these basic functions, the brain is essentially disconnected from the body. The cerebrum, responsible for higher brain functions like thought and consciousness, is unable to communicate with the rest of the nervous system, leaving the body in a state of profound inactivity. Despite how little we understand about the coma state, there have been some intriguing discoveries in recent years. For example, in 2013, doctors treating an epileptic patient in a coma were surprised to discover brain activity in the hippocampus, the part of the brain responsible for memory and emotion. This suggested that the patient's brain might still be engaging in memory processing, even though they were completely unconscious. Although the patient could not communicate or respond to their environment, this finding hinted that the brain might still attempt to protect or heal itself during a coma. Researchers replicated these findings in animals, specifically cats under general anesthesia, and hope that this knowledge could one day lead to new treatments for comas. In addition to brain function, the body can also be affected during a coma. One of the most common issues for comatose patients is muscle atrophy. Since the patient is immobile for extended periods, their muscles begin to weaken and deteriorate. Even in cases where a person is bedridden for only a few weeks, muscle strength can diminish significantly. This is why patients in comas require physical therapy and rehabilitation once they regain consciousness, as their muscles have atrophied from lack of use. Another concern for coma patients is bed sores, also known as pressure ulcers. These develop when a person lies in the same position for too long, cutting off blood flow to the skin and causing tissue to die. If left untreated, bed sores can become infected and spread deep into the muscle or bone. They are notoriously slow to heal and can sometimes take years to recover, with some patients even requiring surgery to remove damaged tissue. Common areas for bed sores include the buttocks, heels, shoulder blades, and the back of the head, where the skin is most likely to be compressed against the bed. In addition to the medical and physical challenges that come with being in a coma, there is also a significant psychological and emotional toll for both the patient and their loved ones. For families, watching a loved one in a coma can be an excruciatingly painful experience. They are often left in a state of uncertainty, not knowing whether the person will wake up, how long it will take, or if they will ever return to their previous mental and physical state. This waiting period can lead to anxiety, depression, and a sense of helplessness. Many family members struggle with the decision of whether to continue life support, especially if the chances of recovery seem slim. This emotional burden can have long-lasting effects even after the patient recovers, with family members needing therapy and support to cope with the trauma of the experience. For the patient, waking up from a coma can be equally traumatic. Some patients experience confusion, disorientation, and memory loss upon regaining consciousness. Depending on the length of time they were in a coma, they may need to relearn basic skills like walking, talking, and eating. If you found this video informative, make sure to give a like, subscribe, and press the bell icon so that you won't miss out on any future videos.